Hello my dear students, I'm Dr. Vaishali Bharambe. I've been teaching anatomy for more than 25 years and I love it. Today is all about Trendelenburg test for gluteal muscles. So what are we going to learn? We're going to learn gluteus medius, gluteus minimus muscles, and then we're going to learn about Trendelenburg test. This is something that often focuses a lot of students, so I'm going to give this to you fast and quick. If possible, please keep a hip bone and femur with you. It might help you to understand this topic a little better. Right. So here you're obviously looking at the hip bone. This is the posterior gluteal line, the anterior gluteal line, and the inferior gluteal line. Taking origin between posterior and anterior gluteal line is the gluteus medius. Between the anterior and inferior gluteal line is the gluteus minimus, the two muscles we will be discussing today. So origin is done. Let's start. Gluteus medius takes origin between the posterior and anterior gluteal lines from the gluteal surface of the hip bone. It gets inserted on an oblique ridge on the greater trochanter of femur as seen here. Note, posterior 1/3 of this muscle lies under gluteus maximus. What about gluteus minimus? Takes origin between the anterior gluteal line and the inferior gluteal line, as we discussed earlier, and gets inserted on the anterior surface of the greater trochanter. Okay, between this and the medius, you may find a little bursa, and this muscle lies almost completely under the gluteus medius. So we've got our two muscles. We know that they are both coming from the gluteal surface of hip bone, inserted on the greater trochanter of femur, slightly more anteriorly. Right. So here you're seeing the greater trochanter. This is the lateral view. The oblique line gives attachment to gluteus medius and the anterior surface gives attachment to gluteus minimus. And this is probably where you see the bursa. Right. So now here you're seeing a beautiful image. This is gluteus medius. See, this is the cut lower end of gluteus medius, and through them in between you are able to see the gluteus minimus. This is your piriformis, and above the piriformis you can see the superior gluteal artery and nerve emerging. The superior gluteal nerve supplies gluteus medius, minimus and the tensor fascia lata. You can see how it takes origin above the piriformis, spreads out between the medius and minimus. This is the basic anatomy of the two muscles. Remember, both the muscles are abductors and medial rotators of the hip joint. I'll just show you what exactly this action is. Here you're seeing the hip bone and femur articulated. Just imagine that the gluteus medius and minimus are in action, abducting the femur on the hip bone, abducting the femur on the hip bone. Now let's fix the femur. If the femur is fixed, then they are able to pull the hip bone towards the greater trochanter of femur. They are able to pull the hip bone towards the greater trochanter of femur. So these muscles can act when the femur is off the ground, bringing about abduction. The muscles can act when the femur is fixed by bringing about a pull on the hip bone. Both these actions are possible by the gluteus medius and minimus muscles. So having understood the action of gluteus medius and minimus at the hip joint, remember always that these muscles can act with the femur being fixed on the ground, in which case they can act on the pelvic bone, with the femur being off the ground, in which case they can act on the femur bone. They can act in both directions. Okay, that's the crux of what we are going to be discussing now, which is the Trendelenburg test. Ready? Okay. So in a normal individual as seen here, when a person is standing, the weight of the body is transmitted through both the vertical limbs, okay, and the pelvis remains automatically supported horizontally. There can be no sagging on either side. This is further helped by action of gluteus medius and minimus. Okay, whenever gluteus medius and minimus act, they pull on the pelvis of the opposite side. Okay, keeping the pelvis horizontal. Both the sides are acting, keeping the pelvis horizontal. I'll show you this, you will understand it. These muscles acting from both sides prevent the sagging of either side of the pelvis. When When is the action of gluteus minimus and medius really noted? Because when the limbs are supported and the person is standing on both the limbs, the action is really not noticeable. Now let's look at a condition where both sides are normal. This person has lifted up one leg. Now there is no support to this side of the hip bone. Now what will it sag down? There is no support. But this side, gluteus medius and minimus, begin to act. As they act, they lift the opposite side of the hip bone upwards, helping to hold the pelvis horizontally. Is that clear? So, this action can be seen here. Just imagine that this is a scale which wants to tip on the other side, but this index finger is holding it in place. Imagine that this hand is your gluteus medius and minimus, which is just holding on to the hip bone, preventing it from falling on the other side. Now let's look at, because of this one single finger, the pelvis remains horizontal or the scale remains horizontal. Now just imagine that this finger is moved. Okay, the gluteus medius minimus are paralyzed. They are unable to hold on to the pelvis. Therefore, the pelvis tilts on the opposite side. Okay, this is exactly what happens in a Trendelenburg test. Okay, in a patient. What happens in a patient? Come take a look. So this is the affected side. This is the unaffected side. The person has lifted the affected side limb. Okay, so what will happen? The gluteus medius minimus of this side are acting. They are holding up the pelvis of the opposite side. There is no sagging. There is no sagging on the affected side at all. Now let's look at this case where this is the affected side, this is the unaffected side. The unaffected side limb is lifted. So this side gluteus medius and minimus are paralyzed. So they are unable to act. Because they are unable to act, the unaffected side is not lifted up by anybody. This causes the pelvis to sag down. This causes the pelvis to sag down. On which side are you seeing the sagging? You're seeing the sagging on the unaffected side. So a patient who has paralysis of one side gluteus medius and minimus will see the normal side of his pelvis sagging every time he walks. You should at this stage get up and walk in this manner with this kind of a lurching gait. You have seen these gaits in so many patients. When every time they step on one side, they are fine. But when they step on the other side, the whole pelvis tilts down and they have to bring the body up again. Okay, this kind of a lurching gait is seen, and this is called as a Trendelenburg sign. This kind of a sagging on the unaffected side is called as Trendelenburg's sign. So I have a question for you. Can you name all the other Trendelenburgs when you're studying medicine? There are so many Trendelenburgs. There's a Trendelenburg sign, procedure, position, and so on. Just enumerate them and put them down in the comment section. It's a challenge for all of you. Okay? All right. I hope you enjoyed this lecture. I love taking this lecture, short and sweet way of learning your Trendelenburg test. All right. If you have any doubts, please feel free to write them in the comment section. I know this is a rather challenging topic for you. I don't know why, but many students just don't understand what is going on whenever Trendelenburg test is discussed. So I'll be happy to help you out in case you have any doubts. See you across the screen in some other video.